I want to come back to your keto continuum. And I think this is a really important piece for people, and you've touched on it, but I want to go deeper into it. The fact that even if you're doing things quote unquote correctly, you're going to hit these plateaus as you go deeper and deeper into this world and continue to find new levels. You're going to continue to want to stress your body in different ways. You hit another plateau, you got to have a pivot at that point and push it even further. So talk about more of that process and give people more of a heads up in that realm, that it's not, this is exactly what you're going to start doing and just follow this for the rest of your life and you're done. There's going to be things that come up and you're going to plateau no matter what. And you need to have certain tools when that happens to have breakthroughs.
Oh, it's exactly where when people pick up the keto continuum and they have read the book or they've heard David's story, often they can relate with the early stages that, you know, he's got a lot of problems. But what I hope people connect with is, you know, David got to several parts in that story and his life couldn't do them. And by that, I mean, do you want to use the slides really quick to say, here's some of the steps and I'll show you where David got stuck? I think it might be useful for you.
I think it's a great time to bring those in.
Okay, perfect. Let's start with this slide. This is what we call keto continuum number 2. And this is a graph that just shows blood sugars and ketones, because we care about what your blood sugar is doing and what your ketones are. This is a 24-hour period. So you can see that sun at the bottom is supposed to represent noon and the moon at the bottom is supposed to represent midnight. And this is a pretty typical American who's eating it, you know, somewhere mid-morning, a little right after lunch, and then gets home at supper time and eats another big meal. Their blood sugars go up to about 155 when they eat, and that's healthy. There's lots of my patients that don't come close to that. But their morning numbers, what I want you to see carefully is that their morning numbers are in the triple digits. So he wakes up with a blood sugar of 100. That cortisol bump at the beginning there says, yep, his blood sugar rises without him even eating. That's just his brain saying the sun's about to rise. And then he never gets below 100 the rest of the day until somewhere in his sleep. When we add ketones there, this is what's happening that first couple of weeks where he has ketones that are in the fun zone. He's got 1 to 1.5 because he is eating only fat and mostly fat. That's what the chicken wings and dipping them in the fat and having eggs and bacon for breakfast and really finding high fat foods for that first week, keeping the carbs low, less than 20. And this is what that success looks like. We call this keto continuum number 2. And what happens shortly thereafter is the ketone sink. This is when they adapt. There are a couple of steps in that where that sink of the line takes, sometimes 4 to 6 weeks. In my really insulin resistant patients, they can have it flatline by the end of the third week. Like they had a wave and then their body adapted. So we say, all right, keto continuum number 4 says we're going to have you eat in 2 boluses a day. So we say, you got to cut out one of the meals, find a way to cope. This is a new, up until keto continuum number 4, we tell them that chemistry really carried you. We told you how to eat differently. The ketones showed up. Everything felt lovely. Your endocrine hormones are rising. Now we need you to add a little discipline, which is we need you to skip a meal in the middle of the day. That's what most people skip. This is the easiest one to find, that they'll eat somewhere around noon, or maybe they, eat their first meal a little later and skip that afternoon one. And they really do not find it challenging, Jesse. The satiety hormones are still working pretty well, and they will see the ketones rise. Now, it's not as lovely as what the first wave was. You'll notice these are from 0.5 to about 1.1. And they do well. They do well for a while. David did well at this point, and he probably stayed here for 6 months. He didn't need to do anything different. But then eventually his body adapted, and he really wasn't seeing ketones. You could wake him up at 3 a.m. and maybe find a ketone above 0.5, but really couldn't find it. And everything in his, his blood pressure was really a big part of his story too. It came down quickly. He didn't know he had high blood pressure. He avoided the idea that he might have high blood pressure, I think. And his waistline had sunk really well for those 6 weeks. It wasn't fast, but it was definitely steady. And he's a very creative man. His creativity was really good. But then he just noticed it feels like it's going backwards. Something's wrong. So this is the first lever that we have patients pull. Well, the first one is to remove that meal. The second lever we have them do is we introduce something called an eating window. What is the first calorie of the day that you eat and the last calorie of the day that you eat. We also include sugar substitutes in that we don't want any there's lots of ways people play tricks on you when you give them rules, and so I've had to change my language. So calorie to calorie is one way to say it, but also we just don't want you adding a whole bunch of mints throughout the day or chewing gum. It really stimulates the insulin on insulin resistant patients. At this stage, we also do allow them to keep fat in their coffee in the morning using that butter or coconut oil or MCT or just heavy cream. And so he really enjoyed that. And so we don't take that away at first. And so that's the eating window. He was able to tighten that up. And like most people, when they first tighten their eating window, it does not help them because if you'll notice, his evening hours are what we're fighting here. If we look at the eating window that's that late, it really doesn't help. So we slide the eating window towards morning. And this is really where this next layer of support group and discipline come in, that you have to stop eating. I mean, really, David's success came when he was able to he did this part and was able to lose another probably 30 pounds. And his ketones were really responsive. It's a little different shape here, just giving you a little more idea of how responsive his body is. It turns on and off that ketone production much better. And I can tell you that while he's sleeping, he's getting a little autophagy there. His mitochondria are improving there. And as we look at other factors that we teach patients, we look at sardine challenges. So this will be the first thing that I did with David was, okay, let's do 72 hours of a sardine challenge and see what happens to this. He actually didn't mind the sardines. And so you'll see that first day he had his normal eating, and then he gets into 24 hours of sardines, 48 hours of sardines. And when you look at that Dr. Bow's ratio at first, that's, at the end, beginning of the first day, he's still at 150. So, I mean, his blood sugars are better, but again, he's waking up in the morning, he's having black coffee and only sardines in oil, but his morning glucose is really stubborn. So by the second day, his blood sugar is lowered into the double digits and his ketones are a little higher, that now we have a Dr. Bow's ratio of 94. So he's losing weight by the second day. And then that final day, right before the 72 hours ends, he's finally pushed that those mitochondria show up. That's that spark to say, here's what I'm trying to do. The beautiful part when you spark the life of a new mitochondria is you get the benefit for 6 weeks. Yes, that 72-hour challenge was difficult for him. He really wanted to eat on the night of that third night. He did not want to get through the night. And I'm like, do not do it. You did not have a good enough ratio this morning. You really need to get a Dr. Bow's ratio in the 40s in order to make mitochondria. And it's that kind of a lesson where he was able to do a much better job with that. The part where I like to tell his story is what he had the best success when he did a water fast. And again, the first day, those blood sugars still too high, and the ketones. So he's got a Dr. Bow's ratio of 120, so better than the 150 with the sardines. But now his second day is not that much better. And this is super common that I see this, Jesse, with insulin resistant patients. The success they get with 3 days of sardines versus 3 days of water, they're pretty similar. And I can tell you why that is if you want to know. But so here's the final moment where he woke up that third day and just said, I couldn't believe how great I felt. And again, a Dr. Bow's ratio of 42 by the third day with, that blood sugar is down to like 75 that morning. And his ketones were like 1.6 or something. Really a nice reward for what we were looking for. And he started putting this 72-hour fast into his life. And it really bothered his wife. Then this is the part of the equation that when you're working with real people, real time, guess what? There's part of their journey that you need to respond to the environment. I want them to change behavior. I want the alcoholic to stop drinking. I want the heroin addict to stop drugging. And I want the carb addict to find pleasure in the foods that are healthy for them, that don't involve processed carbohydrates. But do I expect that to happen the first time they take on what is their demon? What's haunting them from a healthy life? And you've not worked with people long enough if you say, oh, just, do everything perfect on the first go around. That's just not how it goes.
All right, Dr. Boz, let me jump in before we move forward. I got a lot of questions here already. So first one being, you mentioned quickly the fact that on water only and sardines, results would be similar. Talk about why that is.
So again, what is stimulate? So usually we do not do a sardine challenge, and we really don't do a water fast until they're keto adapted. So the audience I'm studying has had ketones produced in the last, 4 months. You'd like to see them maybe the last month, but even if it's just been a while, they've been off the wagon, doc, I can't seem to get ketones to produce at all. They still are keto adapted in that their hormones are working on their behalf. And the resurrection is nothing like we were trying to tackle at the beginning. Insulin resistance is still there, but we have cells that have seen fat recently. They have seen a ketone recently. And when you when you put in that high protein, high fat to a sardine, like the sardine challenge, to an insulin resistant patient, the stimulus for the amount of insulin they're producing when they eat is far less than what they used to produce, even when they ate high fat, high protein. So you first come out of the ketogenic diet, anything you eat is stimulating your insulin. But by the time you've been practicing what I think of as a pretty strict ketogenic diet, and you're failing, you're not having that success, we see the consumption of that highly, sardines are a whole food, right? So it's a high fat, high protein food. And when's the last time you've eaten a sardine, Jesse?
Me, I would say a week ago.
Okay, good.
Not my favorite thing. I hope you can give me some tips on how I can appreciate them more.
Well, the first thing to know is when it comes to the experts in grading fish as far as taste, sardines lose when it comes to smell. So the smell is not their taste. So if I can give people advice, open them outside. That's step one. But the second thing is that the true taste of sardines has a pretty nice flavored palate. It's what is the funnest thing to watch people do this is like, okay, it wasn't as bad as I thought it would be. If you eat tuna out of a can, I'm a Midwesterner, there wasn't oceans anywhere near me growing up, 50 years in South Dakota. So all fish came out of a can. I didn't know it came differently. Maybe you can find a walleye out back, but tuna always had this very sour tang to it. And in the grade of taste for fish, it's that tanginess that our palates really don't like. Well, sardines don't have the tanginess at one of the lowest scores for that. The palate is a very pleasurable taste when you get past the smell. So what I tell patients is, yes, this is where you try to separate this. And the consumption is, there's a few things that come built into eating sardines. A, they come out of a can, so this portion size is controlled. B, the amount of satiety that these little fishes induce, they are really good at stimulating cholecystokinin and peptide YY, some of the hormones that directly link to our neuroendocrine for satiety. So we're playing a game. Yes, there's a game inside sardines. I don't let people substitute for pork belly or other things unless there's other extreme situations, and the results are not anywhere close to being as good. You can say, oh, it's got omega-3s and all these fat, sure, but it also has a powerful punch for satiety. So these little bitty fish coming in a can, and we tell them, I know we've been telling you to eat 2 times a day. We've been saying put the boluses, giving all you these rules. When you're doing a sardine challenge, if you wake up at 3 a.m. and you're hungry, you can eat all you want. So you just take off that restriction, and there's something freeing. The menu's constricted. So you took off one constriction, we put on a different constriction. And with that, it is another reset for how low the insulin goes over these 3 days. The first day, it's not, I mean, it is measurable. When people do a 24-hour sardine fast, I don't see very good, I mean, I see some results, but nothing. 72 hours is the part that is amazing. And we're looking at 3 sunsets there. We really want you to sleep through 3 nights of it. So that's the part where David, whatever hour he started, I was always pushing him to say, you got to get to 72 hours. And I really want it to be in the morning. He really found success in that. And this is a common one. What we're looking for is the distance in time for that robust stimulus of production of insulin. And I will tell you, insulin resistant patients have a ton of success there. There is a rare setting where I see I still use water fast. I think water fasting has other tools built into it. In my patients who have a severe food addiction, like it is their love. It is the thing that's comforted them through night and day, and they consume way more than they should. The consumption is difficult. We start with sardine fasts, but I push them to learn how to do a water-only fast, because learning to say no to food, they do a better job of the no button than they do of the keeping the consumption of sardines lower. I don't know how closely you watch my channel, but there's a gal who did a sardine challenge for 100 days. And it was actually her 3rd time she did this, but she's an incredible teacher to me because of her 100 days of sardines is how she was really able to put to rest the food consumption and how much she was using that to comfort herself. She's like, I could fake it for 72 hours. I could, she even did it once for 30 days. And she goes, at 30 days, I met a few of my enemies, right? Like I could feel what it is I was fighting. But at 100 days, I had this burial for the things I've been fighting. And she is, in her 50s, maybe even early 60s, just the wisdom that she's been hunting for only came about because she was able to distance herself from something that has been her addiction for so long. So it's that tool of not only seeing this incredible metabolic restoration in a 72-hour period with a healthy food. It ranks really high if you kind of compare it to other things. But then also to know that we aren't just dealing with a chemistry set inside their blood. We're dealing with broken hearts and broken brains and the life of people with hurts. And to change those habits become the long game, which is what I'm in it for.
Well, what I'm curious about is somebody that is in it for the long game and they go down the continuum and they keep hitting plateaus and then they hack their way through.
Mm-hmm.
And they get to the point where it's less and less, whether it be sardine fast or challenge, water fasting, tightening the eating window. Do they ever get to a place of metabolic freedom where they find that prescriptive diet and lifestyle where they are producing ketones and they don't have to keep challenging things? Or is that just part of the picture here?
Yeah, no, that's where I live. That's where most people there's a zone on the other side. And I think that is probably the key reason that I'm so committed to having people check their numbers, is that I wish I had the metabolism that my husband does, where he can eat things and not be out of ketosis if I'm the one who birthed the babies, right? I'm the one that gets to do menopause. And there is a metabolism that comes with that. And I know that my life needs to have a good breakfast, that I should have a meal somewhere in the middle of my afternoon. And if I am going to go out for a celebration meal sometime in my week, that I probably want to fast before I do that, if I'm trying to stay the course. When I get into seasons where I don't plan that well and I try to adopt somebody else's metabolism, I can see myself, I see the numbers disappear. I see ketones no longer being produced. I think other things that I'll use my example and then patients' examples I can give as well, but other things that I've added into our life that are, I don't know, maybe we're just boring, but my husband and I have a sauna date. That's where we go to turn off the noise of life and spend time together. we don't necessarily talk, we just both sweat. But it's another place where the science of a metabolic stimulus, of using heat, it really does raise your mitochondria, turn over another batch of them. My metabolism is healthy. And so what I get out of a 30-minute sauna is something that might have taken me 90 minutes 5 years ago. So again, metabolisms rise, how hard you need to push your body. I mean, our bodies aren't meant to just coast. There should be a challenge. There should be a stimulus that you're using to keep your endocrine system in shape, to keep your metabolic system in shape. They don't need to have these extreme 72, pick something, sardines, water fast. But they do need, you will find what is your minimum stimulus to keep your body in the zone where I produce ketones multiple times a week. And I can't imagine life without that, meaning that's the way we're built. That's what should be happening. If I want my brain to work till the day I die, it needs a dose of ketones 4 to 5 times a week. And, supplementing with exogenous ones is a bridge during a season if you're stuck. But what I'd like to do is have my body produce those as routinely as possible, or find you can call them hacks, but I just think it's a stimulus of your metabolism. And if you want your metabolism to fade into the past, then metabolic disease shows up. Sean Baker doesn't have the biceps he has because he doesn't put a stimulus on them. That stimulus is how he keeps his metabolism in the showcase.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
If I had to put one demon out there for the chronic diseases that have filled my internal medicine clinic for 20 years, insulin wins. You can say, Doc, I want to check a fasting insulin. And we have lots of people do that. But the fasting insulin is